My name is Mike Wahl, and I'm an assistant professor of clinical anatomy in the Faculty of Medicine and the Division of Biomedical Sciences. Today, we're going to look at the skeletal system and its articulations. We'll begin with the posterior view. Now, if you palpate your elbow posteriorly, you'll feel three bony prominences. The bump in the center is called the olecranon process of the ulna. The bumps on either side are the lateral and medial epicondyles of the humerus, which can be felt by running your fingers down the lateral and medial sides of your arm respectively until you come to a ridge, which is more prominent on the medial side. First, identify the distal end of the humerus and medial epicondyle. Next, identify the ulna and the proximal part, the olecranon. Here you'll see how the olecranon fits into the fossa to form part of the elbow joint. Identify the radius and the head of the radius. If we follow the radius and ulna to the wrist, you can see that there's a styloid process on both bones, and these can be palpated quite easily. You can easily see how the radius crosses anteriorly over the ulna to get to the pronated position. Now, there are a number of important ligaments found at the elbow joint. The ligament that connects the ulna to the humerus is called the ulnar collateral ligament, while the ligament that connects the radius to the humerus is called the radiocollateral ligament. Collateral just means on the side. Even though the olecranon fits nicely into the humerus posteriorly, these collateral ligaments help prevent excessive adduction and abduction at the elbow joint. There's also a ligament that, like a sling, holds the head of the radius against the ulna, providing stability for the radial head during supination and pronation of the forearm. This ligament is called the annular ligament. Now let's look at some common injuries of the wrist and forearm. One type of injury we see typically in children, because it occurs most of the time around the growth plate, is an avulsion of the medial epicondyle. The ulnar collateral ligament is so strong that the bone avulses before the ligament tears. This tends to happen when a child falls on an outstretched hand, another Fuchs injury, and is also common in young baseball pitchers. The arm is an extension and the force is on the medial side of the forearm. On the normal x-ray, on the top right, you can follow the outline of the medial epicondyle. With avulsion, you cannot. You only see the piece of bone as it appears below the distal end of the humerus. Now, let's look at the subluxation and dislocation of the radial head, a very common injury in young children due to the weakness of the immature annular ligament. As you can see, there are degrees to which the radius can be repositioned. In a subclinical subluxation, the radial head is slightly out of its normal position, but still within the annular ligament. In subluxation, the radial head is completely out of the annular ligament and is lying further distally. In the subluxation and dislocation, the radial head is out of the annular ligament and is displaced laterally, allowing the muscles to pull it proximally. This is the most severe case. The radial head can be seen and palpated as a large lump on the lateral side of the elbow. Now, you probably see parents quite often swing their child like they're doing in this picture because kids love it. At first, you might think this is how the injury would occur, but it's really the case. Most often it occurs when someone is going to grab the child and move them out of the way really quickly. You may have heard of the term pulled elbow or nursemaid's elbow when referring to this type of injury. Another possible injury is an elbow dislocation. Imagine that somebody trips and falls face first, hitting the ground at about a 45-degree angle. They would likely try to break their fall with bent arms. This creates enough force going through their hands that their forearms remain static as the body continues to move downward. In this case, the arm, or the humerus, remains moving downward with the upper body. That force drives the olecranon out of the elbow joint, causing a dislocation and sometimes a fracture of the olecranon, as seen in the x-ray on the lower right. Another injury is called a Colles fracture, and this occurs in the distal radius, usually in elderly women with osteoporosis. A Colles fracture is also a Fuchs injury and happens similarly to other falls on outstretched hands. The difference in all Fuchs fractures is the age of the patient. This fracture is often referred to as a dinner fork deformity because of its shape. The distal end of the radius moves posteriorly, giving a bump that makes the patient's wrist look like a dinner fork. A couple of extra images are included to show you how this fracture presents and to drive home the comparison to a dinner fork. Also notice the alignment of the distal radius and ulna. The styloid processes are in a straight line with the Colles fracture, whereas normally they are on an angle. Check this out on your own wrist and feel the styloid process of the radius that is more distal than the styloid process of the ulna. An AP X-ray of the colice fracture clearly shows the misalignment of the styloid process, but the fracture is not as dramatic as when it is viewed laterally. Next up is a fracture of the distal radius epiphysis. This occurs in children because they're still growing and the growth plates haven't fused yet. Looking at this on the AP X-ray, it looks like a normal epiphyseal joint. On the lateral views, you can see where the fracture occurs and how significant that break really is. Now, this is another Fuchs fracture that is very common for adults that are your age. And somebody looking at this lecture may have actually had this happen to them or had a friend that had this happen to them as well. Now, people your age who slip and fall will most likely fracture the scaphoid, which is a carpal bone located in what's called the anatomical snuff box. I avoid this by being the only person at the skate park wearing wrist guards, and if you've ever broken your wrist, and this bone in particular, you would too. What's particularly interesting about this bone is that it's a peculiar blood supply. The blood supply goes distal to proximal, so if the fracture doesn't heal properly, the proximal fragment will die. This is called avascular necrosis. Most fractures require a cast for about 6 weeks, but this one will require it for at least 12 weeks. If there's more pain in the anatomical snuff box months after the fracture and it should have healed, well then the physician will be alerted that it may not have healed properly. If part of the bone has died, further treatment may require excision, fusion, or a bone graft.